And here we have Director of Public Health Department Svitlana Ostashko and Director of Ukrainian Center for Control and Monitoring Disease at the Ministry of Health, Lyubov Nekrasova. You are given the floor. Good afternoon, everyone. I'm Svitlana Ostashko, as I was presented, the Director of the Public Health Department, Ministry of Healthcare of Ukraine. If I'm here, it doesn't mean that the minister is not concerned. They are just really busy. I would like to remind to you that in the epidemic season of 2015-2016, as it was forecast by the World Health Organization, A, B, and para flu prevails, H1N1, Switzerland, and virus B. And according to operative data of the regional bodies of health department, this season we have about 3.5 million people who fell ill, and compared with previous season, this season it's about 45% more than last year. And in the 5th week of 2016, as of 7th of February, there are more than 300 those who fell ill. Hospitalized person 145,000 people were hospitalized, and more than half of these are children up to 17 years of age. And from the start of epidemic season, there were 246 instances of deaths, several children and one pregnant woman. And in 90% of cases, it was death of H1N1 type of virus, and vaccination. 125,500 people were vaccinated against flu, and the ministry conducts negotiations with the companies, and now they discuss the issue of the vaccination for the most vulnerable groups. As to epidemic season, the situation improved last week. In 19 regions, the epidemic threshold was overcame, and this week only 15 regions, but situation remains rather difficult. And in 4 regions, the threshold now is overcame in 4 regions. There is an operative headquarters in the ministry on the flu and ARVI, and also we have a hotline, and if you have a need, you can phone 0800 800, and you can get consultation. And we involved epidemiologists, pediatricians, and family doctors, and you can get proper consultation. And using this opportunity, let me draw your attention to this. You should do some prevention measures, eat healthy, sleep, wash your hands with soap, and use hygienic means and disinfectors for your hands, and also if you have symptoms of flu, see the doctor. Don't treat yourself. Stay at home if you fell ill. Thank you.
Good afternoon, dear journalists. I would like to inform you that in European region, the epidemic situation with the flu develops slowly, and 41 countries had informed that situation is worsening, and only 6 countries mentioned about average level of flu, and only Finland, Ukraine, and Russia informed about high level of epidemic. The circulation of viruses in resulting in difficult complications is virus A, H1N1, while in Ukraine this season shows the features of a pandemic level of epidemiological situation, and this situation is slightly similar to October 2009 till July 2010, and at that time, around 6% of population were infected with the flu. During that epidemic, 831 patients died because of the complications, and during that, and there were 83 pregnant women, and this year the biggest rise in epidemic was in late December, when 28 people died within 14 days, and the peak of numbers in ill patients amounted to 70 people in January. And the third and fourth weeks of epidemic, which reflected the epidemic rise, and also proves that we informed population on time. And during the last week, there were 17 people who died during the fourth week of epidemic, and as of today we have 226 patients, and 84% of those who died this way H1N1, and we have two patients who died because of virus B virus, and 35 dead people. They died because of A-type virus, but it's not fully type A virus. We will provide those samples to the London centers on flu studies, and they will identify that virus. if you look at the age split of the patients who suffer from epidemic, while in previous cases up to 75% of patients were children between 7 and 14 years of age, this year 46% are adults between 20 and 50 years old, and the majority of patients are people from 30 to 64 years old. Gender split. There is majority of dead patients among men and much less women, 137 men and 109 women. We are very grateful to you for your work. You raised public information, and number of people who appeal to medical institutions at early stages of disease, it considerably grows. Having analyzed the cases of dead patients and found that obesity was of the factors which increased mortality. Also heart diseases, diabetics, multiple diagnoses like heart diseases plus obesity, 24%, neurology, diseases, high pressure, high blood pressures, and what raises our concern that 98 patients had no pathology at all. This are almost 40% of patients. This shows that this virus is very aggressive, and it catches young people who has no chronic diseases. We have registered family cases with lethal results in Chernivtsi. The spouse died, and in Luhansk Oblast, a father and a daughter died because of flu. As of today, epidemic situation remains preserves a higher level of ill people with slight tendency to stabilization. We expect that this week probably it will stabilize further, and next week we expect to observe the trend to shrinking of the epidemic. As for the second wave of epidemics, today it is early to make any predictions about this. The number of patients who experience flu this season may suggest that other viruses might remain inactive, and that H1N1 virus, which appeared very active this time, might become active once again in spring Thank you very much. Now your questions, dear colleagues. Please don't forget to represent yourself.
Ukraine TV channel, Zarina Stepanenko. Question to both specialists. These days, World Health Organization says that the Zika virus, and is there any threat from this disease to Ukrainians? And whether we have some prevention measures? World Health Organization declared about this. It wasn't the first time. In September, there was a session of World Health Organization, and there was a plan of measures to counteract transmissive diseases and Zika and dengue that is spread by insects, and dengue and chikungunya fever was discussed, and then Zika was also included, and all these transmission diseases that are carried by insects, they have a wide area of spread, and they are easily spread because the insect can bite many people. And as to the readiness and what should be done in Ukraine, there's observation of the situation where in places where there are many insects, we have a lot of water bodies, large water bodies, and there the sanitary service conducts some observation, and we calculated the number of insects and also the number of and if we are speaking about those insects that carry this, we have such insects that can carry this virus, but it isn't. There are 5 types of insects. It was established by Lisbon University, and we shouldn't panic. World Health Organization should develop the protocol and algorithm of actions, and we believe that Ukraine is ready to use it and will do all necessary in order to inform about what insects carry these viruses, what is the technology of collecting those insects, and also this raises some concern, and also whether we will be able to diagnose. We have 3 institutions. Our institution, also epidemiological institution that studies these infections, and this is ARVI virus infections, and also an institute in Odessa. They have enough of specialists and equipment in order to diagnose this virus. It's very difficult to say what it will be, because now the mechanisms of transmission they are studied, and scientists work in this sphere, and very powerful laboratories, and for CDC, universities of leading countries, and I hope we will have enough materials in order to study the situation and to control it in a proper way. There are insects that's such a type, but whether they carry these viruses, it should be studied. And in the world, they study Aedes type, and these are and there are many such insects. That's why first they should conduct studies, and then we will be able to say whether they carry this virus. 5th channel, Svitlana Rybashopka, about the flu. And what are the most dangerous situations? And what about the capital and the regions? What is the situation in Kiev? What is the trend? In Kiev, there's a decrease of the virus. for the second week, and as of today, in Lutsk, Ternopil, Zakarpatskaya, Dnipropetrovskaya Oblast, they have still high level of virus. And the next question, 24th channel, Alexandra Potyega, tell us please, you said about humanitarian help, vaccines, and where are they going to be directed, and what is the situation with vaccines in Ukraine? As I told you before, these vaccines are for vulnerable groups. As to the number, we wait for the information from the companies, what number they are going to. We asked for 500,000 doses, but what will be the number, we will know about this later. And we will provide these vaccines to all the oblasts in order to vaccinate vulnerable groups. So maybe channel information about quarantine. Do they lift it, or where is it still imposed? And when the situation will end? Maybe there will be a second wave, but it's very difficult to say at the moment. It depends on the current situation. The dynamics is positive. The situation improves in the regions. That's why schools are open. And yesterday, and as of Sunday, 7,500 schools were closed, and now about 4,000 are closed. So the dynamics is positive, and children now go to school. And decisions, they are taken by local government according to the epidemiological situation in the region. Thank you. And do you have other questions or comments? Please. Yulia Goracheva, STB channel. And among these 4 regions, where is the situation the worst? And the worst situation in Volynska, and maybe the indicator will be the highest in this region. Zakarpatsky 2 times, and maybe in the Dnipropetrovsky, and in. Do you have other questions or comments? If you don't have any comments or questions, thank you. Until the next time.